Dealing with drippy, stuffy, or congested noses is never a fun thing to do.
No. And depending on what you're suffering from, well, we might have something to help. An interesting tool and a very smart doctor with us this morning. Good morning to you.
Thank you.
Dr. Philip Sakonia. Now, before we get to that device, you know, we're talking about this is the time of year when people either have a cold or they might have something called chronic sinusitis. You know, tell us what are some of the best things to, best ways to deal with the common cold?
Well, of course, initially, prevention is key, much like the common flu. Hand washing, avoidance of sick individuals, hopefully sick individuals not going to work and exposing other workers. However, once you come down with the cold, or, a lot of the home remedies are effective. Saline rinses in the nose, salt water, neti pot, hydration, humidification.
Soup.
Soup,
that's
whatever makes you feel better.
Is that true? Now, you know, sometimes we might have to go to a doctor, though, right?
Yes. You know, there's plenty of over-the-counter remedies, expectorants, decongestants, antihistamines, cough suppressants.
It gets confusing,
That's right.
Sometimes.
So, you know, you can consult with a pharmacist about your medical conditions, counterindications, side effects. However, if after 10 to 14 days your sinus symptoms haven't cleared, you may need to see a medical professional.
Right.
And you're saying sometimes what you might have is sinusitis. Please remind us, what is that?
A sinusitis is an inflammation of the sinus membranes, usually bacterial, which usually comes as a complication of a common cold.
And you're recommending a few things here.
Yeah, I think that if you haven't cleared, you know, a common cold within 2 weeks, seeing a medical provider can help you decide on the use of antibiotics or further evaluations and possibly an evaluation with an ear, nose, and throat.
Okay, now we're all intrigued by this green stick that you have here. Okay, what is that?
I mentioned earlier that 500,000 patients may have sinus surgery per year. One of the problems with sinus surgery was a high revision rate or recurrence, and so Intersect ENT has developed the PROPEL Stent, which is the insertion device, and we use this during surgery to deliver this stent into the sinus cavity when we're finished.
Look at that.
Yeah, so we have some animation that you provided to show exactly how this works. So there's this that little plastic thing actually gets inserted
in
your sinuses.
And this stent dissolves in 30 days, but it delivers a steroid, mometasone is the technical name for it. And this stent serves two purposes. One, to deliver the steroid, which reduces inflammation, polyps, and also stents open physically the sinus so it can't close and shut. And that's the novelty of this innovation, is to prevent us to have to go in again and open the sinuses with a second surgery.
So does it usually work that one time and then they're set to go?
Yes,
the studies, makes a lot of sense.
Studies have shown that the patency up to a year already and longer of this result.
How far up are we going, or where are we going?
Into the ethmoid sinus, which is pretty far in, but the patients are asleep when this is inserted.
So do they have any side effects? Like, do they experience pain or anything?
This stent is virtually undetectable by the patient when it's in place, and it dissolves over the course of 30 days, and in the office we can irrigate with sinus rinses and suction in the stent.
That's a great addition for many people.
Yeah, well, Dr. Sakonia, people can check in with you at the Piedmont Surgery Center.
Absolutely.
For more, if they have any questions.
Thank you.
Yeah, thank you.